Hello, my name is Javed. Today is Thursday, May 15, 2025. I'm doing my biology, 230 week 1 anatomy and physiology week 1 video. So here's my 5 question. I'm going to go through this 5 question in slab. The first one, it says, how does anatomy differs from the physiology? So anatomy is the internal and external structure of the body, this body organism, and the physiology is the function. It shows the function of the organism. And my second question is using a person as a model, which will be my daughter. And thank you for volunteering. And the third question, describe an anatomical position and explain why it's important. This is going to be your palm up, and you put your feet away, and that's when the staying face forward. That's your anatomical position, and it's very important. It's give you a consistent framework and enable provided to give you the right direction and the movement of the body. And my third question is going to be, it says, show and name the anatomical region of the body. And also the last one, it says, why is it important for why is the knowledge of the above topic is important for the clinical practices. Anatomy and physiology is very crucial for clinical practices, and it gives you the foundations, and also enable the healthcare provider to do the right treatment, diagnosis, and effective patient care. Okay, so now we're gonna start with my region. So first of all, the body is covered as the two regions: cephalic region and it's a appendicular region. Cephalic is going to be covering your head, and appendicular region basically upper and lower limb. So we're gonna start because they give me only like 5 minutes video. We're gonna make it quick. So first of all, I have your skull, the cranial region, and that's what your skull. And then we have your ears, the aortic region, and we have the ocular region, and the cheek, the buccal region, and you have the chin, which is called the tunnel region, and we have the nose, the nasal cavity or nasal region, the oral region in the mouth, and also as we go, the frontal region is going to be your forehead, and occipital region is going to be your back of your head. And also as we go down your neck, that's called the cervical region, or you have the cervical spine. And as we go down your shoulder, that's where acromial region, and under armpit, that's going to be the axillary region. And thank you. And this is where your chest cavity is, the middle, the breastbone, your sternal region, and you have your abdominal region, and then you have the umbilical region at the bottom, and also you have the pelvic region, which is the pelvis, and then underneath you have the angular region, which is your groin, and also underneath you have the pubic region, which is your genitals. And also if you go to your shoulder, we have the acromial region, and then you have the brachial region, your upper arm, and your elbows will be antecubital region, and your forearm is going to be antebrachial region, and you have the carpal, and also you have your fingers, we call it digits or the manual. Or also your back is going to call the dorsal. Can you turn the dorsal, and you have your vertebrae spine, and you have the lumbar region, and you have the sacral region, and also you have the which is sacral region is going to be your buttocks, and also you have the gluteal region, which is going to be your butt. And then can you turn back? As we go down, you have your femoral region, you have your patellar region, and the back of your knee is going to be patellar region. You have the crural region, the front of your legs, and you have the your heel, and you have the patellar region right here. And those are some of the regions that I explained. And also now we go for the direction in the body. Also and describe them. That's going to be an anatomical position and the direction of the movement of the body. So anything in the front that's going to be anterior, or anything toward the back, that's going to be posterior. And also anything from the middle to the side, they call the lateral, and the middle is right here, we call the middle line, is that's the medial. And also the transverse make your body in half, the lower half and the upper half, and the sagittal that makes your body in this way, front and back. And also they call the toward these joints the proximal and distal. So the distal is something for your main joint going away, and the proximal is which is coming toward the joint. So now giving example, her knee is distal to her ankles, as vice versa I would say her ankle is proximal to her knees. That's how it works. So that will be my 5-minute video. Thank you guys for watching. I'll see you next week for the next video.